Hi guys, today's video will be on angiotensin receptor blockers, also known as ARBs, how they work, what they are used for, and some main side effects to watch for. So let's dive right into how they work. There's something in your body called angiotensin 2 that causes your blood vessels to get more narrow, also known as vasoconstriction, and increases the production of a hormone called aldosterone, both of which raise your blood pressure. So by ARBs blocking the angiotensin 2 receptors, more specifically called angiotensin 2 type 1 receptors, this leads to lower blood pressure. Some examples of ARBs are Valsartan, Losartan, Olmesartan, Erbisartan, and Telmisartan. As you probably noticed, they all end in sartan. As a quick side note, if you watched my previous video on ACE inhibitors, you would know that ACE inhibitors also impact angiotensin 2. So ARBs are generally not combined with ACE inhibitors due to the increased risk of side effects since they work pretty similarly. As touched on previously, ARBs are mainly used for lowering high blood pressure to prevent heart attacks, strokes, and kidney damage, but they have other uses too. They can also be used to protect the kidneys in patients that have diabetes and protein in their urine. Remember, diabetes is the leading cause for kidney failure per the National Kidney Foundation, so protecting the kidneys here is super important. ARBs can also be used for heart failure. Basically, they prevent too much stress on the heart and prevent the heart failure from getting worse. I want to stress that these medications are in addition to exercising more, losing weight, quitting smoking if you smoke, avoiding too much alcohol, eating less salt, and just eating healthier in general. Alright, so regarding side effects, I'm going to mention the ones I thought were the most important to know, but as mentioned in previous videos, these are not all-inclusive lists. So in general, ARBs are pretty well tolerated. Like all blood pressure medications, they can sometimes contribute to the blood pressure dropping too low, which can then cause dizziness. Interestingly enough, this seems to happen more in ARBs than in ACE inhibitors. And like ACE inhibitors, ARBs can also raise potassium levels, also known as hyperkalemia, which your doctor will generally monitor for. If your potassium levels start getting too high, your doctor may have you cut back on foods high in potassium, reduce the dose of your ARB, or stop it altogether. Sometimes they add a medication to reduce potassium levels. ARBs can also contribute to headaches and can make you more tired or fatigued. Many blood pressure medications can contribute to erectile dysfunction issues, ARBs included. Interestingly enough, while these medications are used to protect the kidneys, your doctor will usually monitor the kidneys closely since ARBs can hurt the kidneys in certain serious situations such as renal artery stenosis, severe congestive heart failure, severe dehydration, etc. This is generally very rare. Unlike ACE inhibitors, ARBs are generally not known for coughing and angioedema, which is swelling of the face, lips, and tongue. They can still happen, but much less frequently than ACE inhibitors. I do also want to mention the whole recall fiasco that happened in the last couple years regarding ARBs. As you probably already heard, certain batches of Valsartan, Erbisartan, and Losartan were recalled due to impurity issues that were potentially cancer-causing. Those specific batches with impurity issues were recalled and removed, so the batches being used currently should be good to go. In regards to pregnancy, ARBs should not be used as they can harm the baby. Regarding drug-drug interactions, ARBs can interact with certain medications, so make sure to check with your pharmacist before starting a new medication or supplement if you are taking an ARB. So that's it for today. If you learned something or found value from this video, make sure to hit that like button. If you want more easy to understand content on health and medicine, make sure to subscribe to the channel. And last thing, this video is for educational use only. This video is accurate to the best of my knowledge as of the date posted, but data is constantly changing, so always consult your doctor and pharmacist regarding your medications and what would be best to do in your specific situation. Thank you for your time and stay healthy. See you next time.